welcome. This is Dr. April Carrillo, and today we're going to learn how to draw blood from a PICC line. So the supplies you're going to need for today's skills will include a set of gloves, alcohol swabs, a vacutainer with a male adapter, tubes. The color will depend on the order and specimen that you will need to collect, 2 to 3 flushes, patient labels, and a pen. So you're going to want to start by sanitizing your hands. After you apply the sanitizer, you will then don your gloves. After you've put your gloves on, you're going to want to open all of your supplies. With the flushes, there's usually an air bubble. You're going to want to make sure that you remove that air bubble so we don't introduce that to the patient's PICC line. This can be potentially harmful to our patient as it could introduce an air embolus into the line. Once you have your supplies open, you can now perform the skill. We're going to start by removing the Kuros cap. And even though we do have a Kuros cap, we still want to scrub the hub as we do not want to introduce any potential bacteria or pathogens into the patient's line. Make sure when you're scrubbing the hub, you are scrubbing it for the standard 15 to 30 seconds. Now we're going to attach our first flush, and using a pulsating motion, we are going to flush all but the last ml. We traditionally reserve this last ml, again, to prevent any potential air bubbles from entering the patient's line. We will start to draw back blood, the entire amount of the flush, the full 10 cc's. This is going to be our waste. We will dispose of that accordingly. We can now attach the male adapted vacutainer. From there, you can place your tubes and collect your specimen. Once the specimen is full, make sure you gently shake it back and forth and try to make sure that you're filling those tubes up as much as possible. Once you've collected your specimen, we now need to clean and flush the line. You're going to want to use 10 or 20 cc's depending on your hospital policy. You're going to want to use that same pulsating motion, reserving all but that last ml to prevent an air bubble from entering the patient's PICC line. Once you have completely cleaned the line, you're going to want to remove the final flush, make sure you clamp the PICC line, and we're going to reattach a new Kuros cap. Once you have flushed the line completely, you now have your specimens collected. You're going to want to grab your patient labels, make sure to date, time, and initial the labels appropriately. Place those labels on the tubes. When placing the label on the lab specimen, be sure to do so by placing it alongside the tube in a lengthwise fashion. Do not wrap the label around the tube, preventing the lab technician from being able to verify the patient's name, date of birth, and your initials on the specimen. Dr. April Carrillo here. Thanks again for joining me today with drawing blood from a PICC line. As you can see, it can be a really fun skill, and we don't have to poke our patient. So make sure you get in the lab and practice, practice, practice.